You wake up at 2 in the morning, not because of a noise, not because of a dream. You wake up because your mouth feels like you swallowed a handful of sand. You reach for the glass on your nightstand, the one you started keeping there about 6 months ago because this keeps happening. You drain it. You lie back down. 20 minutes later, you're up again. This time it's your bladder. You shuffle to the bathroom, half asleep, and on your way back, you notice your feet feel off. Not painful exactly. More like you're walking on a layer of something that isn't quite floor. Like there's a thin sock between your skin and the ground that you didn't put on. You get back into bed. You tell yourself it's nothing. You're just getting older. Everybody gets up at night. Everybody gets thirsty. Your feet are probably just cold. And here's the thing. You're not wrong about any of that individually. Any one of those things in isolation is completely unremarkable. But when 3 or 4 of them show up together, quietly, without fanfare, without any dramatic moment that sends you rushing to a doctor, that's not aging. That's a pattern. And that pattern has a name. What I'm about to walk you through today are 7 early warning signs that your blood sugar is running higher than it should. Not diabetes necessarily, not yet. I'm talking about the stage before the stage, when your body is sending you polite, quiet letters that most people throw in the trash because they look like junk mail. They're not junk mail. They're registered letters from your pancreas, your nervous system, your vascular walls, and every single one of them is saying the same thing. We're losing the battle, and we need you to pay attention. Now, here's what most people get wrong. They think high blood sugar is about sugar. You ate too many sweets, you drank too much juice, you had cake at your grandson's birthday. That's not how this works. In roughly 80% of the cases I see in my practice, the problem isn't what went into the mouth. The problem is what's happening at the cellular level, in the way your body processes, distributes, and responds to glucose. And that process starts breaking down years, sometimes a full decade, before anyone hands you a diagnosis. I've been doing this for 17 years. I've sat across from hundreds of patients who came in for something completely unrelated, a sore knee, a skin rash, fatigue, and walked out with a blood sugar reading that changed the entire conversation. Not because they were careless, because nobody told them what to look for. That changes today. One thing before we dive in, and I mean this sincerely, I am not your doctor. I don't know your medical history, your medications, your family background. Everything I share in this video is educational. It's based on clinical evidence, on published research, and on 17 years of seeing real patients in a real practice. But it is not a substitute for sitting down with your own physician and getting your own numbers checked. If anything I described today sounds like you, that's not a reason to panic. That's a reason to book a blood test. Clear? Good. Let's go. Hit subscribe right now if you haven't already. We're building something here. A channel where you actually learn what's going on inside your body instead of getting a leaflet and a 6-minute appointment. We're pushing toward 300,000 subscribers, and every single one matters. Like the video too, it genuinely changes how many people see this. And what I'm about to tell you is something most people don't hear until it's already too late. So, let's get into it. Sign number 1. The thirst that water doesn't fix. Everybody gets thirsty. That's normal. But there's a specific kind of thirst that shows up when blood sugar starts climbing, and it feels different. It's not the thirst you get after exercise or after eating something salty. It's a background thirst, a low-level, constant, nagging sensation that never fully goes away no matter how much you drink. You finish a full glass of water, and 15 minutes later, your mouth is dry again. You start carrying a water bottle everywhere. You wake up at night reaching for liquid. And the strangest part, you're drinking more than you ever have, but you somehow feel less hydrated than before. Here's what's actually happening. Think of your bloodstream as a river. Under normal conditions, glucose molecules float along in that river at a manageable concentration, roughly 70 to 100 milligrams per deciliter when you haven't eaten. That's the healthy range. Now, when blood sugar rises above that, your blood becomes thicker. Not dramatically, you're not turning into syrup, but enough that your body notices the change in osmotic pressure. Your brain has a tiny cluster of cells called osmoreceptors. Think of them as water level sensors in a dam. When they detect that the river is getting too concentrated, they send an emergency signal. Dilute. Bring in more water. Now. So you feel thirsty. You drink. But here's the cruel part. Because your kidneys are simultaneously trying to flush out the excess glucose through urine, you're losing water almost as fast as you're taking it in. It's like trying to fill a bathtub with the drain open. You drink and drink and drink, and none of it sticks. Your body is running a deficit it can't close. If you've noticed that over the past few months your water intake has quietly doubled, and you're still waking up with a dry mouth, that is not a hydration problem. That is a glucose problem wearing a hydration costume. Sign number 2. You're exhausted, but you slept 8 hours. This one is brutal because it mimics so many other things. Stress, poor sleep quality, depression, iron deficiency, age. Every single patient I've seen with early-stage elevated blood sugar has said some version of the same sentence. I don't understand it, doc. I'm sleeping fine, but I'm dragging through the day like I haven't slept in a week. Let me explain why this happens, because it's counterintuitive. Glucose is fuel. It's literally the primary energy source for almost every cell in your body. So you'd think that having more of it in your blood would give you more energy, more fuel, more fire, right? Wrong. Completely, dangerously wrong. Think of it this way. Imagine your cells are houses, and glucose is the mail. Insulin is the postman. Under normal conditions, the postman picks up the glucose from the bloodstream and delivers it straight to the front door of every cell. The cell opens the door, takes the glucose, burns it for energy. Beautiful system, efficient, quiet. Now imagine the locks on those doors start getting stiff. The postman shows up with a stack of mail, but the doors won't open easily. He pushes, he jiggles the handle. Some doors open halfway, some don't open at all. The mail starts piling up on the sidewalk. The blood is full of glucose. There's fuel everywhere, but the cells aren't getting it. They're starving in the middle of abundance. That's insulin resistance. And the fatigue you feel isn't because you don't have enough energy in your system. It's because the energy can't get where it needs to go. Your muscles are underfed. Your brain is underfed. Your mitochondria, the tiny generators inside every cell, are running on fumes while the bloodstream is overflowing with fuel they can't access. This is why a nap doesn't fix it. This is why coffee stops working after a while. This is why you feel most exhausted about 90 minutes after a meal, because that's when your blood sugar peaks and your cells are screaming for glucose they're surrounded by but can't touch. If that sounds like your afternoon, every afternoon, that's not laziness. That's not age. That's a metabolic signal. Sign number 3. Cuts and bruises that take forever to heal. This is one of the subtlest signs, and people almost never connect it to blood sugar. You nick your finger chopping vegetables. A week later, it's still not fully closed. You bump your shin against the coffee table. Happens to everyone. But 3 weeks later, there's still a faint bruise. Your spouse heals from the same kind of thing in 4 days. You take 12. Why? Because healing is one of the most energy-intensive, circulation-dependent processes your body performs. When you get a cut, your body launches a complex repair sequence. White blood cells rush to the site. Platelets form a clot. Fibroblasts start building new tissue. Collagen lays down a scaffold. Every single one of those steps requires 2 things: adequate blood flow and adequate glucose delivery to the cells doing the work. When blood sugar is chronically elevated, 2 things go wrong simultaneously. First, the excess glucose damages the walls of your smallest blood vessels, the capillaries. Think of it as sugar crystals slowly scratching the inside of a garden hose. Over time, those tiny vessels become narrower, stiffer, less efficient at delivering oxygen and nutrients to tissue. Second, your white blood cells, the ones that fight infection and coordinate repair, become sluggish. Published research shows that when blood glucose consistently runs above 140 milligrams per deciliter, white blood cell function drops measurably. They move slower. They eat bacteria less effectively. They communicate worse. So the construction crew is tired, and the supply road is narrower. Of course, the repair takes longer. Pay attention to this one. it's easy to dismiss. But if you're noticing that small wounds linger, especially on your legs and feet, that's not thin skin. That's compromised microcirculation. And it's one of the earliest visible signs of sustained hyperglycemia. Here's a question for you, and I'm asking because I genuinely want to know. Have you noticed any of these first three signs in yourself? Not in someone you know, in you. Drop a comment, even just the number, 1, 2, or 3. It helps me understand what's resonating and what I need to go deeper on in future videos. Your comment literally shapes the next script I write. Seriously. Sign number 4. Your vision blurs, but only sometimes. This one confuses people because it comes and goes. You're reading a menu at a restaurant, and suddenly the letters swim. You blink a few times, it clears up. Next morning, perfectly fine. A week later, it happens again while you're driving, just for a few seconds. You think maybe you need new glasses. Maybe you're tired. Maybe the lighting was bad. Here's what's actually going on. The lens of your eye is a living structure. It absorbs fluid from surrounding tissue to maintain its shape and focus. When your blood sugar spikes, the glucose concentration in the fluid around the lens changes. The lens absorbs more water than usual. It swells, just a tiny bit, fractions of a millimeter, and that's enough to change its focal length. Your focus shifts. Things go blurry. Then your blood sugar comes back down, the lens returns to normal, and your vision clears. This is not an eye disease. Not yet. This is a mechanical response. Your lens is acting like a barometer for your blood chemistry. And the fact that it comes and goes is actually the key diagnostic clue, because permanent blurriness suggests a different problem. But intermittent blurriness that correlates with meals or time of day is a textbook early marker of glucose instability. I want to tell you about someone. I'll call him Gerald. 61 years old, retired electrician, came to see me because he was convinced he had early cataracts. His optician had checked him twice, said his lenses were fine, and Gerald was frustrated because he knew something was wrong. "Doc, I can read the paper perfectly at 7 in the morning," he told me, "but by lunchtime I need a magnifying glass. And by dinner I'm fine again. That's not normal." He was right, it wasn't normal, but it wasn't his eyes. I ran a fasting glucose, 98. Technically within range. Then I ordered an oral glucose tolerance test, where you drink a measured glucose solution and we track your blood sugar over 2 hours. At the 60-minute mark, Gerald hit 187. At the 90-minute mark, 172. At 2 hours, he was still at 151. His fasting number looked fine on paper, but his body was taking far too long to clear glucose from his blood after eating. That's impaired glucose tolerance, the clinical precursor to type 2 diabetes. And his lens was telling him about it every single day at noon. Gerald didn't need glasses. He needed a metabolic intervention. And when we made dietary changes, which I'll walk you through in a few minutes, his blurry lunchtimes disappeared within 6 weeks. Not because we treated his eyes, because we treated his blood sugar. That's the thing about the body. Symptoms rarely show up where the problem lives. You have to follow the trail. Sign number 5, tingling or numbness in your hands and feet. This is the one that scares people, and honestly, it should get your attention. Not panic, attention. Because by the time you're feeling pins and needles in your fingers or a strange numbness in the soles of your feet, especially at night, glucose has been doing quiet damage for a while. Here's the mechanism. Your peripheral nerves, the ones that run to your fingertips, your toes, the surface of your skin, are among the longest, thinnest nerve fibers in your body, and they're incredibly sensitive to their blood supply. Chronically elevated glucose does 2 things to these nerves. First, it damages the tiny blood vessels that feed them. Same capillary injury I described earlier with wound healing. The nerve fibers start receiving less oxygen, less nutrition, less support. Second, and this is the part most people don't know, glucose itself, when it's consistently too high, triggers a chemical process inside the nerve cells called glycation. Think of glycation as sugar coating the internal wiring. It stiffens the proteins inside the nerve, disrupts signal transmission, and eventually causes the nerve fiber to degrade. This is called peripheral neuropathy, and it doesn't arrive with fanfare. It starts as tingling, a slight buzzing sensation. Maybe your feet feel like they've fallen asleep even though you haven't been sitting in a weird position. Maybe you notice you can't feel temperature as well. The shower water has to be hotter than it used to be before you register that it's warm. Maybe you drop things more often because your fingertip sensitivity has quietly declined. Research published in the journal Diabetes Care shows that approximately 50% of people with type 2 diabetes will develop some degree of neuropathy over their lifetime. But here's the critical part. Nerve damage often begins during the pre-diabetic stage, when blood sugar is elevated but hasn't crossed the official diagnostic threshold. A study from the University of Michigan found measurable nerve fiber loss in patients whose fasting glucose was between 100 and 125, the pre-diabetic range. That means by the time you get a diabetes diagnosis, your nerves may have been under siege for years. The tingling in your feet isn't the beginning of the problem, it's a progress report. Sign number 6. You're getting more infections than you used to. Urinary tract infections, yeast infections, skin infections, gum infections, fungal infections between the toes. If you've noticed a pattern, not one infection but a recurring theme, this is a sign worth paying attention to. Glucose is food, not just for you, for bacteria and fungi too. When your blood sugar is consistently above normal, you're essentially creating a buffet for opportunistic organisms. Every surface in your body, your urinary tract, your skin, your gums, the warm, moist areas between your toes, becomes a more hospitable environment for microbial growth. But it's not just the sugar. Remember those sluggish white blood cells I mentioned earlier? Your immune system's first responders are running at reduced capacity when glucose is elevated. Studies show that neutrophils are the frontline soldiers of your immune system, drops significantly when blood glucose exceeds 200 milligrams per deciliter. But even at more moderately elevated levels, 140 to 180, there's a measurable dip in how efficiently your immune system identifies and eliminates threats. So it's a double hit. More fuel for the invaders, weaker defenses on your side. That's why recurring infections, especially if your doctor has tested and treated you and they keep coming back, shouldn't be dismissed as bad luck. It may be that your internal environment is fundamentally tilted in favor of the organisms you're trying to fight. I had a patient, I'll call her June, 67, lovely woman. Came to me because she'd had 4 urinary tract infections in 7 months. Her gynecologist had treated each one with antibiotics. Each time it cleared up, each time it came back. She was frustrated, uncomfortable, and starting to worry that something structural was wrong. I asked her one question. June, do you happen to feel thirsty a lot? She looked at me like I'd read her diary. How did you know that? Her fasting glucose was 119. Her hemoglobin A1C, which measures your average blood sugar over the past 3 months, was 6.3%. Pre-diabetic. Not diabetic, not flagged, just quietly, consistently running too high for her immune system to keep the urinary tract clear. We addressed the blood sugar. She hasn't had a UTI since, 8 months and counting. And here's where the good news begins. Because everything I've just described, all 7 of these signs, they don't point to a broken system. They point to a system under strain. And strain can be relieved. These processes can be slowed down, interrupted, and in many cases reversed, not with a pharmaceutical intervention, but with targeted changes in how you eat, move, and time your daily habits. And that's exactly what I'm going to give you right now. Sign number 7. Unexplained weight changes, and not the kind you'd expect. Most people assume that high blood sugar means weight gain, and it can. But here's what catches people off guard. Early blood sugar dysregulation can also cause weight loss. Or it can cause a strange redistribution, where your arms and legs get thinner but your midsection expands. You're not eating more. You might even be eating less. But your belt keeps getting tighter. Here's why. When your cells can't properly absorb glucose, that insulin resistance I described, the stiff locks on the doors, your body panics. It needs fuel, so it starts breaking down 2 alternative sources, fat stores and muscle tissue. You lose muscle mass from your limbs. You feel weaker. Your metabolism slows. Meanwhile, the excess glucose that's floating around in your blood gets converted to fat and stored preferentially around your abdominal organs, what's called visceral fat. It wraps around your liver, your kidneys, your intestines. And visceral fat is not passive storage. It's metabolically active. It releases inflammatory compounds that make insulin resistance worse, which raises blood sugar further, which creates more visceral fat. It's a loop, a self-reinforcing cycle. And the external signal, the one you can see in the mirror, is a waistline that grows even when the scale doesn't change dramatically. Clinically, a waist circumference above 40 inches in men or 35 inches in women is considered a strong, independent risk factor for metabolic syndrome, regardless of overall body weight. If your pants fit differently than they did 2 years ago and you haven't changed your eating habits, that's not middle age spread. That's visceral redistribution driven by insulin dynamics. And it's reversible. Now let's talk about what to do. And I'm going to be specific because vague advice is useless advice. I'm not going to tell you to eat healthier or exercise more. I'm going to tell you exactly what, when, and how much, and why each step works physiologically. All of this is affordable. None of it requires special equipment or supplements. These are kitchen-level, daily habit changes that target the specific mechanisms I've just described. Method 1. The post-meal walk. This is the single most underrated blood sugar intervention in existence, and it costs nothing. Here's the physiology. When you eat, your blood sugar rises. That's normal. The question is how high it goes and how long it stays elevated. Skeletal muscle, the muscles in your legs, your arms, your core, can absorb glucose from the bloodstream without insulin. When muscle is active, it opens alternative channels called GLUT4 transporters that pull glucose directly out of the blood, bypassing the insulin system entirely. This is clinically significant because it means you can reduce your post-meal blood sugar spike even if your insulin signaling is impaired. The instruction. Within 15 minutes of finishing your largest meal, walk for 10 to 15 minutes. Not power walking, not jogging, just walking. A gentle, comfortable pace. Research from the University of Otago in New Zealand found that a 15-minute walk after dinner reduced post-meal blood sugar by an average of 22% compared to a single 45-minute walk taken at a random time. Timing matters more than intensity. Do this after dinner every single day. If you can do it after lunch as well, even better. But dinner is the priority because evening blood sugar spikes tend to be higher due to natural circadian fluctuations in insulin sensitivity. Your body processes glucose less efficiently in the evening than in the morning. No equipment, no gym membership, just shoes and a sidewalk. Method 2. The vinegar protocol. This sounds strange, I know, but the evidence is remarkably consistent. 1 tablespoon of apple cider vinegar diluted in a full glass of water consumed roughly 15 to 20 minutes before a carbohydrate-heavy meal has been shown to reduce the post-meal glucose spike by an average of 20 to 35%. Why does it work? Acetic acid, the active compound in vinegar, slows gastric emptying, which means your stomach releases food into your small intestine more gradually. This results in a slower, gentler rise in blood glucose rather than a sharp spike. Additionally, acetic acid appears to enhance glucose uptake in muscle tissue, working alongside that GLUT4 pathway I just described. A tablespoon in a glass of water before your main meal. That's it. Use a straw if you're worried about your tooth enamel. Acetic acid is acidic, and drinking it through a straw minimizes contact with your teeth. Don't drink it undiluted, ever. Always in water. The brand doesn't matter. The cheapest apple cider vinegar on the shelf works identically to the expensive ones with the pretty labels. Caution: if you take metformin or any medication that lowers blood sugar, talk to your doctor before adding this, because combining glucose-lowering strategies without supervision can push your levels too low. Cost: roughly $2 to $3 for a bottle that lasts a month. Method 3. The fiber front-loading technique. This one is about the order you eat your food. Not what you eat, the order. And it makes a measurable difference. Research published in Diabetes Care showed that when subjects ate vegetables and protein before carbohydrates during the same meal, same food, same total quantity, just rearranged, their post-meal blood sugar was approximately 37% lower than when they ate carbohydrates first. The reason is mechanical. Fiber from vegetables forms a gel-like layer in your stomach and upper intestine. When carbohydrates arrive after the fiber, they have to work through that layer before they're absorbed. This slows the rate at which glucose enters your bloodstream. It doesn't block it, it paces it. Think of it as a speed bump on the road to your blood sugar. Instruction: at every main meal, eat your vegetables and salad first, then your protein. Then your starches and grains last. Don't skip the starches, just eat them at the end. This is not a diet, it's a sequence. Same plate, same food, different result. Method 4. The morning hydration anchor. First thing in the morning, before coffee, before breakfast, drink a full glass of water at room temperature. Not cold, not hot, room temperature. Approximately 300 to 400 milliliters. Why? Overnight, your body has been in a fasting state for roughly 7 to 8 hours. During that time, you've lost moisture through breathing, through light perspiration, and through the normal metabolic processes that continue while you sleep. Your blood is at its most concentrated point of the entire day. Concentrated blood means higher relative glucose readings, thicker flow through capillaries, and less efficient kidney filtration. Rehydrating first thing dilutes blood glucose concentration, supports kidney function for the day ahead, and, here's the part most people don't realize, improves your body's insulin sensitivity for the subsequent meal. Studies have shown that even mild dehydration, as little as a 1 to 2% body water deficit, measurably impairs insulin signaling. This is free. It takes 30 seconds, and it primes your metabolic system for the entire day. Method 5. The sleep timing rule. Blood sugar management is not just about food. It's about sleep, specifically about when you go to sleep relative to your last meal. Here's the rule. Stop eating at least 3 hours before you lie down. Not before bedtime, before you lie down. Because horizontal positioning changes how your digestive system operates, and eating close to sleep extends the post-meal glucose elevation into your overnight fasting window, which disrupts your body's natural glucose clearing processes. A study from Osaka University found that people who ate within 2 hours of bedtime had significantly higher fasting glucose the following morning compared to those who maintained a 3-hour gap, even when total caloric intake was identical. Your body does some of its most important metabolic housework while you sleep. Give it a clean workspace. The weekly protocol: how to layer these in without overwhelm. Don't try to do everything at once. Here's how I'd structure this. Week 1, start with 2 things only: the morning water and the post-dinner walk. That's it. Get those established as automatic habits. They require no purchases, no cooking changes, no disruption to your routine. Week 2, add the food sequencing. Vegetables first, protein second, carbohydrates last. Start practicing this at dinner only. Once it feels natural, extend it to lunch. Week 3, introduce the vinegar protocol before your largest meal. Monitor how you feel. Some people notice a reduction in that post-meal heaviness almost immediately. Week 4, enforce the 3-hour gap between your last meal and lying down. Adjust your dinner time if needed. This might be the hardest one if you're a late eater, but the metabolic payoff is substantial. By the end of 4 weeks, you've built a complete daily protocol that addresses blood sugar from 5 different angles. No supplements, no prescriptions, no monthly subscription to anything. Now, let me give you the cheat sheet. If you screenshot anything from this video, make it this part. Morning, drink 300 to 400 milliliters of room temperature water immediately upon waking, before anything else. Every main meal, eat vegetables first, protein second, starches and grains last. Before your largest meal, 1 tablespoon of apple cider vinegar in a full glass of water, 15 to 20 minutes before eating. After dinner, walk for 10 to 15 minutes within 15 minutes of finishing the meal. Gentle pace, no need to rush. Evening, finish your last food at least 3 hours before lying down. Daily, monitor changes in thirst patterns, energy levels, wound healing speed, and peripheral sensations in hands and feet as personal early warning indicators. And here are the red flags, the moments when self-management stops and professional evaluation starts. If you're experiencing persistent numbness or tingling that's getting worse, not better, if you have blurred vision that lasts more than a few hours, if you develop a wound on your foot that hasn't begun to heal within 2 weeks, if you notice sudden, unexplained weight loss of more than 5% of your body weight in a month, if you develop frequent, recurrent infections that antibiotics can't seem to permanently resolve, any of these, see your doctor. Get a full metabolic panel. Ask specifically for fasting glucose, hemoglobin A1C, and a fasting insulin level. That third one, fasting insulin, is the one most doctors don't order routinely, and it's often the earliest indicator of insulin resistance, years before glucose levels cross into the abnormal range. Everything I've walked you through today is designed to support your body's natural function. It does not replace clinical evaluation when something needs to be examined. I'm not your doctor, but I've been someone's doctor for 17 years, and I can tell you that the patients who do best are the ones who show up informed. Not anxious, informed. There's a difference. Tell me your age in the comments. Just a number. I'm not asking casually. I'm building future videos around the specific age groups watching this channel because a 52-year-old and a 68-year-old have different risk profiles, different metabolic baselines, and different priorities. Your number helps me build content that actually fits your reality. And now I want to say something that I think matters more than any individual protocol. Nobody in a white coat is going to sit with you for 30 minutes and walk you through what we just covered. Not because they don't care. Most of them do. But because the system wasn't built for this. The system was built for volume, for 8-minute appointments, for diagnostic codes, for prescriptions that manage symptoms. Prevention doesn't have a billing code. Education doesn't generate revenue. And the economics of modern healthcare mean that the conversation we just had, the one about what's happening inside your body and what you can do about it before it becomes a diagnosis, that conversation almost never happens inside a clinic. That's not a conspiracy. That's not cynicism. That's just how the incentive structure works. And it's exactly why this channel exists. So if you found this useful, genuinely useful, not just interesting, but something you'll actually do, hit subscribe, hit like, and then do something that actually matters. Send this video to one person. Not everyone on your contact list. One person. The person you're thinking of right now. The one who's always tired. The one who keeps getting infections. The one whose feet tingle at night and who tells everyone it's nothing. Send it to them. Because sometimes the most important medical intervention isn't a prescription. It's information that arrives at the right time. I'll see you in the next one. Take care of the body. It's the only one that shows up every day whether you look after it or not.